Welcome to the last screencast on health and disease. This screencast looks at smoking and its health effects. Okay, so the first slide here looks at the effect of smoking on the mammalian gas exchange system with reference to symptoms of chronic bronchitis, emphysema, and chronic obstructive pulmonary disease and lung cancer. Okay, so a lot to fit in on this slide. Okay, so first of all, dealing with cigarette smoke. The main components of cigarette smoke that have health implications are tar, carbon monoxide and nicotine. Dealing with tar first of all, that lines the respiratory tract and alveoli, and that increases diffusion distance for oxygen and carbon dioxide, which reduces the efficiency of gas exchange. Okay, the tar also causes an allergic reaction, which causes a constriction of the bronchioles. Okay, which is an asthma, difficulty in breathing. Okay, so that constriction of bronchioles increases resistance of the movement of air through the bronchioles and makes it more difficult to breathe, and that's asthma caused by allergic reaction to the tar. Also, tar paralyzes cilia, okay, and that reduces the clearance of mucus. Okay. Tar also increases mucus production by the goblet cells that line the respiratory tract, and the bacteria grow in that mucus, okay, and that leads to chronic bronchitis or inflammation of the lung due to the bacteria causing infection in the lining of the bronchioles, which leads to coughing up mucus with bacteria and white blood cells in it. Okay, the increased coughing, okay, also causes damage to the alveoli, and I'll look at that later when we look at emphysema. Infection increases white blood cell invasion, okay, and the white cells, as they burrow in from the bloodstream into the alveoli, release an enzyme which breaks down the elastic material in the alveoli. Okay, there's an elastic material around the outsides of alveoli called elastin, and to be able to get access to the alveoli, these white blood cells break down or release an enzyme which breaks down the elastin, which means that the alveoli lose their ability to recoil when you're exhaling. Okay, and that, in combination to the increased coughing that you had when you had your bronchitis, causes alveoli to burst. Okay, if they burst, you get reduced surface air in the lung. Okay, and the symptoms would be the patient would be short of breath, and that disease is known as emphysema. Okay, so emphysema is caused by infection, which results in white blood cells invading alveoli. White blood cells release enzyme to break down elastin, okay, which results in alveoli bursting, which reduces surface area of the lung, and the symptoms are shortness of breath. Okay, as well as that, lung cancer. Okay, you've got to know about lung cancer here. Tar contains carcinogens, which are cancer-causing chemicals that cause mutations in the DNA of cells of lung tissue, and those then rapidly divide, okay, to form a tumour, a cancer, which takes 20 to 30 years to develop. Okay, the symptoms of that is blood and sputum, shortness of breath. Okay, are the symptoms of cancers. Okay, and then this word chronic obstructive pulmonary disease, COPTA. Okay, that is basically a disease where you have a reduction of permanent airflow, and that can be caused by all three of the things that we've just talked about. Okay, so the emphysema, the chronic bronchitis, and the asthma all combine to give you a chronic obstructive pulmonary disease. Okay, so I've got a short video here to hopefully illustrate some of those points.
Smoking damages two main parts of your lungs: your airways, also called bronchial tubes, and small air sacs called alveoli. With each breath, air travels down your windpipe, called the trachea, and enters your lungs through your bronchial tubes. Air then moves into thousands of tiny alveoli, where oxygen from the air moves into your bloodstream, and the waste product carbon dioxide moves out of your bloodstream. Tiny hair-like projections, called cilia, line your bronchial tubes and sweep harmful substances out of your lungs. Cigarette smoke irritates the lining of your bronchial tubes, causing them to swell and make mucus. Cigarette smoke also slows the movement of your cilia, causing some of the smoke and mucus to stay in your lungs. While you are sleeping, some of the cilia recover and start pushing more pollutants and mucus out of your lungs. When you wake up, your body attempts to expel this material by coughing repeatedly, a condition known as smoker's cough. Over time, chronic bronchitis develops as your cilia stop working, your airways become clogged with scars and mucus, and breathing becomes difficult. Your lungs are now more vulnerable to further disease. Cigarette smoke also damages your alveoli, making it harder for oxygen and carbon dioxide to exchange with your blood. Over time, so little oxygen can reach your blood that you may develop emphysema, a condition in which you must gasp for every breath and wear an oxygen tube under your nose in order to breathe. Chronic bronchitis and emphysema are collectively called chronic obstructive pulmonary disease, or COPD. COPD is a gradual loss of the ability to breathe, for which there is no cure. Cigarette smoke contains at least 40 cancer-causing substances called carcinogens, including cyanide, formaldehyde, benzene, and ammonia. In your body, healthy cells grow, make new cells, then die. Genetic material inside each cell, called DNA, directs this process. If you smoke, toxic chemicals can damage the DNA in your healthy cells. As a result, your damaged cells create new unhealthy cells, which grow out of control and may spread to other parts of your body. The most common cancer in the world is lung cancer, with over 1 million new cases diagnosed every year. Harmful chemicals in cigarettes can cause cancer in other parts of your body, such as in the blood and bone marrow, mouth, larynx, throat, esophagus, stomach, pancreas, kidney, bladder, uterus, and cervix.
Okay, so just quickly going through that. So you remember the 3 components of cigarette smoke. Okay, and remember the effect that tar and carbon monoxide, and particularly tar involved in this case, has on the lungs. Okay, so that deals with the effect on the lungs. Remember to distinguish these effects from the effects that we're about to look at in terms of the cardiovascular system on the next slide. Okay, so moving to the next slide. This slide deals with the effect of nicotine and carbon monoxide on the cardiovascular system, with references to lead to atherosclerosis in arteries, coronary heart disease, and strokes. Okay, so dealing with the components, nicotine and carbon monoxide first of all. Nicotine, what that does is it causes a release of adrenaline from the adrenal glands, okay, and that causes an increase in blood pressure by causing constriction of arterioles, okay, so arterioles around the body, okay, which are smaller arteries which can change their diameter. Okay, the diameter of these arterioles gets smaller, and obviously that decreases the volume of the circulatory system, which increases the blood pressure. Okay, that increase in blood pressure causes damage. Okay, the increase in pressure can cause damage to the endothelial cells that line the arteries. Okay. In the extremities, okay, so in arms, legs, limbs, etc., arterial constriction, okay, can cause tissue death because the tissues don't get enough oxygen, and that's called anoxia, okay, and that can lead to the requirement of amputation of limbs for people that are long-term smokers. Also, nicotine can also make the platelets which are involved in blood clotting stick, increasing thrombus clot formation. Okay, so it increases the likelihood that platelets will cause a clot to form. Okay, and that's particularly important when it comes to heart attacks and also strokes that we'll see in a minute. Okay, carbon monoxide, dealing off of carbon monoxide, that binds to hemoglobin to form carboxyhemoglobin, which reduces the ability of the hemoglobin to carry oxygen, and therefore less oxygen is supplied to tissues. Okay, the carbon monoxide can also damage the lining of the arteries too. Okay, so both nicotine and carbon monoxide damage arteries. Okay, and the damaging of those artery walls is the first step in the formation of this disease called atherosclerosis, which we looked at before when we looked at HDLs and LDLs and cholesterol when we looked in the diet unit earlier on. Okay, so the damage of the artery wall is the first step in this formation of atherosclerosis, and that attracts white blood cells to the area which is damaged. Okay, and then cholesterol, which is delivered by LDLs, and white blood cells build up under the endothelial lining. Okay, in the middle layer of the artery, and that creates a thing called an atheroma. Okay, a build-up of these things, cholesterol, white blood cells, causes an atheroma. Okay, and that atheroma builds up, okay, and partially blocks the artery, which leads to restricted blood flow, and that's known as atherosclerosis. Okay, and obviously that restricted blood flow means that less oxygen gets to the tissue beyond that restriction in the arterial. Okay, and that can lead to coronary heart disease. Okay, so atheromas, these blockages or partial blockages in coronary arteries, restrict blood flow to heart. Therefore, there's less oxygen, which leads to angina or chest pain. The less oxygen is made worse by the carbon monoxide. The fact that the blood that does pass your partial blocked artery contains less oxygen than it might, because a lot of the hemoglobin is bound to the carbon monoxide, which is also in that cigarette smoke. Okay, so that leads to chest pain, which is known as angina. Okay, and as I say, these can also lead to blockages of the arteries, which leads to heart attacks too. Okay, and then dealing with strokes. Okay, so a stroke is a sudden loss of brain function, and that's due to a blood clot in the brain. As we said up here, nicotine makes platelets stick, increasing the thrombus formation. So a sudden clot in the brain caused by the nicotine, causing the platelets to perform a clot formation. Okay, that can lead to strokes. Okay, so nicotine increases likelihood of clot formation, and the carbon monoxide also reduces oxygen supply to tissue, which exacerbates the problem of smoking and strokes. Okay, so again, I've got a little animation here to try and illustrate some of those points.
Smoking dramatically increases the risk of cardiovascular disease, including heart disease, heart attack, and stroke. When cigarette smoke is inhaled, toxic gases pass through the lungs and into the bloodstream, causing every organ to be exposed to these toxins. Tobacco within cigarettes contains nicotine and many other compounds. As the compounds burn, thousands of harmful chemicals are released. Many of these chemicals are known to cause cancer. In the bloodstream, carbon monoxide from cigarette smoke binds to hemoglobin found in red blood cells, and this interferes with the delivery of oxygen to tissues throughout the body. In addition, nicotine and carbon monoxide can damage the inner lining of the walls of the arteries, causing an increased risk of fatty deposits at the injured site. These fatty deposits, called atherosclerotic plaques, can cause significant narrowing of the blood vessels, which can severely reduce blood flow. In coronary artery disease, atherosclerotic plaques within the heart vessels can reduce or block the flow of blood to the heart, possibly leading to angina or chest pain. In more serious cases where the heart muscle is starved of oxygen for too long, an area of the heart muscle may die, causing irreversible damage. This is commonly called a heart attack or myocardial infarction. When nicotine in the bloodstream flows through the adrenal gland, it stimulates the release of a hormone called epinephrine. This hormone causes the heart rate and blood pressure to increase, potentially putting an added strain on the heart. Smoking also increases the risk of blood clots because it causes platelets in the blood to become stuck together. In some cases, a blood clot can travel to the brain, causing a blockage within an artery, preventing the supply of much-needed oxygen and nutrients. This is commonly known as a stroke. Following a stroke, the area of the brain affected may no longer function normally, possibly leading to disability. In severe cases, a stroke can be fatal.
Just a quick postscript on that video. The word epinephrine, which was used, is an American word for the hormone that we call adrenaline. Okay, so where it says epinephrine causes an increase in blood pressure, translated into English, that means adrenaline causes an increase in blood pressure. This last slide requires you to evaluate the epidemiological and experimental evidence linking cigarette smoking to disease and early death. So dealing with this word epidemiological, okay, so what that does is it links behaviour with disease in a population. Okay, so what we do is we look at all the various people that have certain behaviours, okay, and see what they have as diseases and make a link between the two. Okay, so one could obviously link link smoking, the amount of cigarettes that you smoke, with, for example, the likelihood of developing heart disease. So within a population, you could find out which people smoke and which people have heart disease and make a correlation. Okay, that you can only make a correlation, really. You can't actually say that the smoking actually causes the heart disease. Okay, because there could be all sorts of other linked factors which could cause the heart disease. So, for example, the individuals could have, smokers might have higher obesity levels, okay, eat more saturated fatty acids, have higher levels of LDLs in their blood, and that could be the thing causing the heart disease, not the smoking. Okay, or they could take less exercise, which could also be a factor in their heart disease, and not actually the smoking at all. So, whilst we could make links and correlations between a behaviour and a particular disease, okay, it doesn't actually directly illuminate the cause of the disease. Okay, so there are links between smoking and mortality due to heart disease. Okay, but as I say, they're just links, correlations between. We can't actually. There isn't evidence that could actually say that the smoking actually causes the heart disease. Okay, as I've already outlined, the disease could be due to other factors. Okay, there's genetic factors. People are more predisposed to heart disease than others. Okay, dietary factors, we all talked about. Alcohol consumption is also a factor in development of heart disease too, and it's possible that our smokers might also drink more alcohol. Okay, so that's why we have to be careful about saying that smoking may cause heart disease. All we can really say is there a correlation between smoking and heart disease. Okay. And also there is also links with lung cancers and COPD with smoking. Okay, so those are, as I say, you can sometimes be given some experimental evidence in the form of a graph. You might be asked to describe it. Okay, be very careful when you are making any form of inference or conclusion. Just say there's a correlation between, rather than saying that smoking causes heart disease, okay, in that respect. Okay, you might also be asked to, as it says, evaluate. Okay, the sort of things you could talk about in an evaluation are things about the size of your sample. Obviously, the bigger the sample, the more reliable your results are going to be. Often in epidemiological studies, the use of questionnaires is used in populations, and obviously there is varying degrees of accuracy in the way that people answer questionnaires, okay, which would affect the reliability of your results. Okay, and you've also got to look at it's very difficult to standardize experiments in epidemiological studies because all sorts of other factors apart from smoking may affect the outcome. So, for example, as the ones we just talked about, diet, alcohol consumption, the age of the individuals asked, and all of these things would have an impact on what they would put down on their questionnaire, which would make the results fairly unreliable. Okay, so those are the things to think about when confronted about a question about epidemiological evidence. Okay, so that completes our screencasts on health and disease.